COVID-19 and wastewater, a report on health surveillance systems. Passive surveillance is the first of four types of surveillance system. It's the most common type of surveillance, and it's generally when reports are given by physicians or labs or clinics, and they rely on those to get their data. An example of this is COVID-19 case notifications from laboratories as they come in. Active surveillance happens when public health agencies seek out data actively. It provides more detailed and targeted information relating to the spread of illness and their geographic locations. An example of this is contact tracing that happens when COVID-19 cases spread across the globe or communities. Syndromic surveillance is the reporting of health events by health professionals who are selected to represent a geographic area or a specific reporting group. An example of this is a health representative from a particular state in the US reporting on what is happening with COVID-19 in that state. It's very effective in prophylactic monitoring as we get immediate data in regards to what is happening in a particular state, and we can potentially prevent the spread to other areas in the US or globally. An example of this is the manager of an emergency department monitoring for respiratory cases and reporting them based on what they're seeing. Sentinel surveillance focuses on symptoms or symptom groups rather than specific clinical or lab data. This could be monitoring for symptoms of the flu, such as fever or vomiting, as well as respiratory issues such as coughing or wheezing, rather than looking at specifically positive clinical or laboratory testing. Why do we look at wastewater? Wastewater monitoring can detect viruses spreading from one person to another within a community earlier than clinical testing and before people who are sick go to their doctor or hospital. Wastewater testing measures viral activity within water, and therefore it can indicate whether or not there is the presence of disease before specific clinical or laboratory testing is provided, and potentially before massive outbreaks occur or before the disease is identified for what it is. We could see an increase in viral activity in wastewater before we identify that there is a COVID-19 outbreak, allowing us to prophylactically intervene in its management. The type of public health indicators that are tracked in this kind of situation are the likes of the viral activity in wastewater, trends in viral activity over time, and the geographic differences in viral activity, allowing us to see specific and targeted data relating to viral activity. Alongside these, reported infections, hospital admissions, deaths, and immunization uptake are also tracked to help us get a broader scope of what is happening. Despite wastewater being an effective method for tracking health and illness, there are some challenges. In the US, many areas have low wastewater tracking coverage. This can mean that data is incomplete or inconsistent. Additionally, wastewater tracking is not directly indicative of actual cases. Just because there is a high or low viral activity in the water does not mean that there is genuine cases of infection. And as a result of a decrease in clinical testing over time or an uptake in immunization, it may be difficult to confirm cases. How is this used? Decision makers continue to use data to inform COVID-19 policy and mitigation decisions with an eye towards protecting the public. If we notice an increase in cases or an increase in viral activity, this may indicate that we need to step up interventions such as lockdown procedures or an increase in public health education programs. It may also mean that we need to assign resources to different locations based on specific geographic data, or take away resources in places where it's improving.